The Spanish flu pandemic was announced to the world in 1918 and it spread to all parts of the globe. Although the outbreak did not originate in Spain, Spain was a neutral country during World War I and thus had no reason to censor the announcement of it. According to Richard J. Hatchett, the pandemic is believed to have infected a third of the world population and killed somewhere from 50 to 100 million people worldwide. People were not prepared at all to deal with this kind of pandemic, and it did not help that the virus spread incredibly rapidly. Spanish flu was caused by an influenza virus, H1N1, and it was spread amongst people through saliva droplets when coughing, sneezing, or talking. While there were multiple influenza outbreaks throughout the 20th century, this outbreak significantly had the highest case fatality proportion of them all, and was unusually high in young adults. The outbreak in the United States affected different cities with different intensities, whether assessed by total excess deaths, the rate of increase in the epidemic curve, or peak death rates. When the first cases of disease struck the United States, cities that shut down almost immediately faced a much less significant outbreak in their cities when compared to cities that failed to take action for as little as 1 week. Statistical studies since 2000 have indicated that while people of all socioeconomic statuses were affected by the pandemic, the poor had the highest mortality rates. During this time period, African Americans were subject to many racial theories ranging from biological inferiority to barriers in medical and public health to poor health status. Along with the lack of political and economic power in the African American community at the time, these racial theories led the African American community to have a poor standard of living amongst all of their individuals. According to Sven Erik Mamelund in his article Profiling a Pandemic, factors that increased a person's risk of catching and dying from H1N1 included poor nutrition, overcrowding, living conditions conducive to secondary infection with bacterial pneumonia, pre-existing infection with other diseases, and low access to health care, or inadequate understanding of health information because of low literacy. The African American community was subject to all of these factors because of the racial theories outlined earlier that forced them into a life of poverty and many other inequalities. It had been held by some people at the time that African Americans had higher mortality rates in such diseases as tuberculosis and pneumonia due to their biological makeup, when the real cause behind this disparity was socioeconomic inequalities. The causes behind the mortality rates in African Americans due to the Spanish flu was no different. Due to segregation at the time, African Americans had to set up their own hospitals and medical facilities, which quickly became overwhelmed and undersupplied due to their lack of funding. Despite these circumstances, however, African Americans still reported lower mortality rates among their communities than white Americans did, with the Chicago Department of Health analyzing and reporting these results. Vanessa Northington Gamble theorized that these results may have stemmed from the fact that while African Americans did not contract the disease as much, when they did contract it, they died at a higher rate because of their worse social conditions. Another theory was that African American deaths may have been underreported due to their inadequate access to medical care. However, the fact remains that public saw this contradiction to the prevailing theories of inferior African American health, but still did nothing to try and help the African American community. There remained no new major changes in opportunity for black medical professionals, no attempts by white people to try and initiate change for the poor health conditions of African Americans, and there were no publications overturning racist scientific theories about African Americans. Due to this and the continued suppression of the inequalities of the African American community, today's current pandemic, COVID-19, is also disproportionately affecting African American communities. While COVID-19 may not directly affect African Americans any differently than anyone else, the poor health conditions in many African American communities due to poor housing conditions and poor access to health care has led to a higher mortality rate amongst these communities. Risk factors that increase the deadliness of COVID-19, such as hypertension, diabetes, and obesity, are highly prevalent in African American communities due to their lower socioeconomic status, reports Clyde W. Yancey. The most effective strategy of combating COVID-19, social distancing, is also more challenging for many African communities because of their high housing density due to the communities in which they reside. The solution to solving the social justice issue is not as simple as flicking a switch, but it is feasible. We can start by increasing the availability of healthcare and improving the quality of housing in African American communities. Increasing the availability of healthcare would allow more African Americans to know what health conditions they have and be properly suited to be treated for these conditions in health and in sickness. Improving the quality of housing would decrease the risk of individuals developing risk health factors that would put individuals at more risk should another pandemic strike. Both of these solutions should not have to be implemented just because of how the current pandemic is affecting certain demographics poorly. These are basic rights that all people should be entitled to, and while there may not be anything that we can do to help the African community out during this crisis, hopefully they will be better suited and prepared for the next crisis.
Because that's what heroes do.